One of the biggest healthcare fraud cases in U.S. history.
Several agencies announcing that they charged 324 people accused of taking millions from the federal government. Queen City News anchor Will Lewis joining us now in the studio. And Will, the feds say this went on for years.
Yeah, good morning to you, Jason and Julian. One operation ran from 2017 to 2024, according to the U.S. Attorney and Attorney Generals from North and South Carolina. Now, this resulted in millions of dollars in claims paid to several people, and some of the patients allegedly being treated when the claims were submitted were dead. Now, when announcing the arrest, Russ Ferguson, U.S. Attorney for the Western District of North Carolina, said these people were stealing from every taxpayer because the cases involved Medicare and Medicaid fraud. There were a couple of cases talked about, but one in particular was in North Carolina, where Crystal Jackson, owner of Jackson Consulting Services, allegedly received $1.6 million in Medicaid claims for fraudulent drug testing and psychotherapy sessions. Investigators say some of the services were never given or not needed medically. And in the drug testing claims, investigators say Jackson even created a fake lab which also billed the state for false claims. Now, Jackson was also charged with transactional money laundering because the money was used to buy a car, pay rent, and get food deliveries.
If you engage or if you exploit our Medicare and Medicaid programs, we will find the red flags, we will trace the money, we will uncover your scheme, and we will bring you to justice.
And all agencies say investigations are ongoing. Some of the defendants, including Jackson, have already agreed to plead guilty. Others will start making their appearances in federal court in the next coming weeks.
All right, well, thank you. And joining us now is our chief legal analyst, Khalif Rhodes. Will was just touching on one of them, and obviously we know there's over 300 people charged. Some of them they're charging for services that people didn't need, like wheelchair therapy from the VA for veterans that didn't even need this. Khalif, I can imagine there will be no restraint going after these people that have stolen taxpayer dollars.
Yeah, no restraint at all, and rightfully so. I mean, this is, I think, one of the folks, I listened to the entire press conference. I'm not sure if it was Alan Wilson from South Carolina or the Western District U.S. Attorney, but they said that these aren't just white-collar crimes that are victimless, that they don't just happen on paper, but they hurt individuals that are actually out there attempting to get resources. Because if you would have capped out a person's Medicare and Medicaid availability, and then that person actually went to go get the services they need, and they were like, hey, you're denied because you've already capped out. And they're like, hey, I've never even used this service before. Right. That would be problematic. And now you got to go through the red tape of trying to figure out, well, how do you get the services you need at that time? And so, yes, this was a great example of interagency working together. Folks, I mean, you talk about the IRS was there, Department of Health and Human Services was there, the FBI. I mean, you had all kind of agencies working together to ensure this was a great coordination of work across the board.
And some of these stories coming out, it's unbelievable, right? One Charlotte woman billed almost $2 million for services never even given. What happens to the patients who thought they were getting care, but they never did? I mean,
I think this is a mixed bag. I mean, because a lot of the allegations aren't just that these are folks, saying to Julian, for instance, hey, this is a service you needed and I never provided. When you look at a lot of the allegations, they were billing for folks that were dead. They were billing for folks that were just grabbing random numbers. So this wasn't saying that I came into your facility and asking for services, even though I think that was part of what occurred. It was also, majority of it was that they were just randomly connecting services to people where they had information and availability to do it. That was probably the largest portion of it. I mean, they're talking about gift cards and bogus labs, fraudulent medical equipment, giving kickbacks. I mean, this sounds like something out of like the record industry back in the day, trying to get your artists, to the top of the charts. I'm going to give you as many kickbacks. I mean, if I'm giving you a gift card because you come to my facility, but then I know that I'm going to, I may give you a $25 gift card, but then you're actually getting, $30,000 for the service. Those are the things that they don't want to have happening. And so for sure, this is something that was problematic. And the grabbing of the names for services from the people that were dead, that is going to be one that you can't run away from. You can't hide. There's really no defense for that.
And Khalif, when you talk about the government attorneys in the case they billed, when they set their sights on somebody, they usually do not miss.
Well, it usually don't miss. I mean, 90% conviction rate, I should say. And so you heard them mention that a couple of these individuals had already agreed to plead guilty. We're finding out about this, I will say, late in the game.
Right.
If once they stand up there and they're having that press conference and they got any of those billboard, those slides that are showing you, the people's names on this, guarantee that they've already received some type of investigation letter, that you're a target of an investigation, and then that person is scrambling to try to find legal representation. And during that process, the attorney is talking to the attorney for the Western District or wherever it would be, and they're saying, okay, this is what we got. This is what your client's going to take, or we're going to trial, and we will convict them. So we're catching, I guess, the tail end of the show, but the show has been going on behind the scenes for a longer time. And the fact that it was coordinated, I mean, because this was part of a larger investigative process, everyone is going to get a win here. And when I say everyone, I'm not talking about the defendants. Every prosecutorial office that's engaged in this investigation is getting a win today. This is not just a pat yourself on the back win, though. This is we've saved folks dollars. We've saved the Medicare and Medicaid industry from fraud that was ongoing. And the last part I'll mention is the investigation is still ongoing. So if you're at home watching, that's why they gave that warning. If you're out there, if you're committing these types of things, we'll follow the money, we'll trace it back, and we will find you. That was the biggest deterrent ever. I mean, if someone is sitting at home and they're doing this now, you may want to stop because they're looking for you and they have found the way to find you.
Well, and I'm surprised. I guess if someone's going to do harm or evil, they're going to figure out a way to do it. I'm surprised with the amount of technology and now AI and multiple agencies. I don't know how you can think you're not going to get caught at some point.
100%. I mean, Alan Wilson said that they used a number of forensic analysts. They used a number of AI type of things to find and track and connect these type of spending and purchases. In that first one that Will talked about, I mean, those transactions aren't really hard to find if you're talking about ordering food, paying rent payments, and purchasing vehicles that have nothing to do with the services. Typically, if you're billing Medicare or Medicaid, it's going to be directly connected to a service. And so that's probably what the major red flags is. And you heard the U.S. Attorney say, we're looking for the red flags. And so if you're going to commit some type of crime like this, at least have it buttoned up where you don't leave those red flags. But even if you do the best that you can do, because you have multiple angles, they're looking on the healthcare side, right? But they're also looking at the tax side. And if both of those things aren't reconciled, if you aren't able to say, well, these numbers match these numbers, well, that's the biggest red flag. And so then I think that's how you begin to get eyes looking at you and folks to start to try to figure out, all right, this is something that doesn't smell right. And if it doesn't smell right, most of the time it's time to throw it out.
Queen City News Plus. Just search Queen City News on your smart TV's app store.